What a lot of patients and even clinicians don't realize is that whenever a patient moves from site to site within the healthcare system, there's a risk of harm. There's information that gets lost. There are care plans that can be interrupted, whether it's administering an antibiotic or making sure that someone gets the right pain medicine. And so it's vitally important that there's continuity across those transitions in care. It's something that anesthesiologists pay a lot of attention to in making sure that those transitions are smooth and safe. The vision for the Department of Anesthesiology is to be the consummate department of perioperative medicine. We take care of patients across the spectrum of perioperative care. So we're part of the team that's helping decide if surgery even makes sense for a given patient. We're helping optimize them for that procedure. We're helping get them through the procedure safely and comfortably. And for many patients, they end up in the intensive care unit. We have to take care of them and support critical organ systems as they're recovering. And then we try to get them home comfortably and safely.
The division of the Department of Anesthesiology here at Columbia is to be a preeminent Department of Anesthesiology, and the vision within Pediatrics is to contribute to that, to deliver high-quality pediatric care, to deliver high-quality research, and train leaders in the field. As pediatric anesthesiologists, we care not only about our care in the operating room, but how our care impacts the child after they leave the operating room. And that may involve going to the ICU and making sure that they're optimized for their ICU stay, and also to ensure that they have good pain control, good control of other complications as they enter the recovery room and go home.
Our ICU is intentionally multidisciplinary. Most of our faculty are anesthesiologists, but we also have an intensivist group that includes surgeons, emergency medicine physicians, and a pulmonologist, and we're all working together in one team. That one team takes care of patients in 3 intensive care units. Our specialty really is taking care of patients who are significantly ill. We take care of patients who've undergone transplantation, patients who receive mechanical circulatory support. We train fellows from anesthesiology, surgery, emergency medicine, and obstetrics. We do this training in the same ICU without any silos. We believe that's important to the delivery of the best critical care that we can provide. Part of this training emphasizes that what we do for patients preoperatively will have an impact on the patient's course postoperatively in terms of their recovery and ventilation times.
It's important to understand what's happening in the operating room, the surgical considerations, whether it be how you manage a complex cardiac lesion, the types of resuscitations that happen in the operating room, any complications that you're managing, whether it be ischemia, blood loss, heart failure, and providing that context to the providers that are taking care of the patient in the intensive care unit is essential. You give them context, you give them guidance, and it's that continuity of care and that really personalized touch that I think makes Columbia and our department special.
Being an obstetric anesthesiologist and having been trained in delivering anesthetic care to obstetric patients and sort of understanding the risks that can present often unexpectedly to the obstetric patient population. So whether that's severe hemorrhage or septic shock, serious infection or heart failure, those things can all present often without warning. So having the experience as a critical care physician to really help support the patient and help stabilize them, to help keep them safe throughout that peripartum period is really such a wonderful opportunity.
We really think about clinical care as something that is the core of what we do, that's bolstered by research, because in the course of clinical care, you always have questions that you can't answer. And research is one of the key tools that we have to answer those questions so that for the next patient, we have the right answer and we can move forward and help that patient recover, or at least help them get the best quality care that's possible. Education is a key part of that too, because we have to train the next generation. I will also say that our trainees keep us humble because they ask us questions about why we do what we do and whether we couldn't do it better. And so I see the trainees as a core part of improving the clinical mission because they force us to get better.
I think that the best research questions always stem from a real clinical problem. I am a mixed methods researcher, which means that I combine quantitative and qualitative approaches to try and understand population level problems. Most of my work is focused in palliative and end-of-life care, and so I spent a lot of time trying to understand how we can do a better job of delivering palliative and end-of-life care to patients with serious illness. And of course, patients in the ICU or patients with critical illness are one really important population of patients with serious illness.
This department has a deep sense of mission, and it's the main reason that I'm here. We understand where we're based. We're based in Washington Heights in New York City, which is a socioeconomically challenged part of this city and part of this country. Everyone, no matter whether they're a pain medicine physician, an ICU physician, an anesthesiologist, someone who's doing pediatrics, they all understand why we're here. We care about our patients, that our patients depend on us. And really, it's that North Star that keeps us all rowing in the same direction.
Thanks for watching, but now an important disclaimer. The content of this video is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Viewers should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions.